Well, I'm 61 years old. I lived in Maywood for 59 years.
I did my high school years here. I met my high school sweetheart. We got married here.
This is my home.
The village of Maywood was going back and forth in the beginning of the pandemic of being the #1 community as being widespread.
Us in public health knew that this pandemic, like any disaster, always disproportionately impacts the most vulnerable.
So it became clear very early on that Black and brown communities were being particularly hard hit.
People of color that's in these neighborhoods, they cannot get the resources that they need.
COVID is real here. I've been to a lot of walk-through funerals.
Information just didn't get to us, as quickly as it should have.
It was frustrating for me from a trustee standpoint that the residents were calling saying, why doesn't Maywood have a place we can get testing? Why doesn't Maywood have a place we can get testing?
Really immediately, the feeling of the importance of outreach, of understanding the people that were going to be our patients in their context, in the community context, was really important.
CERCL is trying to be there for those that doesn't have access to food, to testing, or to education.
The acronym stands for COVID Equity Response Collaborative Loyola. It's a collaborative, an interprofessional collaborative of nursing, faculty, students, and staff, medicine, law, public health, healthcare administration.
We need to be good citizens in the communities in which we serve and really come together and work together to find solutions that address these problems of inequity and can be sustained and improve health for the long term.
We're not telling them what they need, right? We're hearing what they need, right? And we're sort of responding.
Reaching out into getting testing into those communities, going to where they are so they don't have to travel out of their communities to get this testing. As a future physician, meeting those individual people, helping them is why I want to do this, really build that community relationship.
Loyola brings credibility. People believe in Loyola around here. For them to reach out and be actually here at 9th and Madison, means a lot.
The mission of CERCL is to address the health inequities that our communities of color are facing on a daily basis.
During this pandemic, African Americans were 1.4 times more likely to get COVID-19 than white Americans, as well as nearly 4 times more likely to be hospitalized and nearly 3 times more likely to die. Hispanic people were nearly twice as likely to get COVID-19 than white Americans, over 4 times more likely to be hospitalized, and nearly 3 times more likely to die. Of the community members treated at Loyola University Medical Center, 34% of COVID-19 cases in African Americans and 44% of cases in Hispanics progressed to severe infection or death. The new COVID-19 vaccine promises to be a valuable tool in our fight to end this pandemic. Studies have shown that the vaccine provides 95% protection after 2 doses against COVID-19 in persons 16 years or older. Most patients do not have major side effects of the vaccine, only minor ones like redness, pain, and swelling at the injection site. Some patients may develop a fever or mild headache with the vaccine, but that does not mean you have been infected with COVID-19. Rather, your body is reacting to the vaccine in order to produce antibodies that will protect you from the virus. The COVID-19 vaccine is one of many ways to protect ourselves and our loved ones, and may be an important step toward returning to a normal life. Knock out COVID, get vaccinated.
Good evening, and thank you for joining us for a conversation tonight.
Before we get started, I first wanted to make some quick introductions and some acknowledgements. I am your host, Abigail Silva. I'm an assistant professor at Loyola University and an epidemiologist and health equities researcher. I also co-lead CERCL, which stands for the COVID Equity Response Collaborative Loyola. So CERCL is a team of public health, medicine, nursing, law, and social work students, professionals, and staff working in partnership with community leaders and public health officials to minimize the negative impact from COVID to vulnerable communities in suburban Cook County, particularly in western suburban Cook County. Now, I will lead off our conversation tonight, which will be followed by at least 30 minutes of question and answer with some experts and a community liaison. Dr. Nayeli Mora is an assistant research professor at Loyola and an infectious diseases epidemiologist who will speak about women and children in context of the vaccine. She will also be one of the panelists during our question and answer session. Dr. J.B. Bertuman is an infectious diseases specialist with Metro Infectious Disease Consultants, and he will join us in the conversation as well, along with Dr. Tomas Morales, who's an internal medicine resident, has been working with the community on COVID testing. And we will also be joined by Ms. Gwen Smith-Haney, who is our CERCL community liaison, and she will offer her experience and insight on issues related to the vaccine. Let's see. All right, before I move on, I'd like to acknowledge the Loyola Medicine's COVID-19 Vaccine Community Advisory Council for their support, along with the support of the Village Press. Tonight, I would like to spend just the first few minutes providing you with an overview of where we are in the current pandemic with regards to cases and vaccination efforts. And then Dr. Mora will then share with you current information about women, children, and available vaccines. Again, the final 30 minutes will be spent answering questions from the community, such as the ones that were received when folks registered for the town hall or our conversation. And ones that folks might post on the chat while we stream live throughout the evening. So tonight, I would like to focus on the pandemic as it relates to suburban Cook County, and even more specifically, West Suburban Cook. So this graph illustrates why. The most recent data shows that West Suburban Cook County has experienced the most number of COVID cases per capita than the other regions of suburban Cook County. And the rate of total cases is very similar to that of the city of Chicago, except for west suburbs don't have nearly the same level of resources as the city does to fight this pandemic. So here's a map that allows us to take a closer look. So here, the map on the left are the areas that are highlighted in darker blue are the ones that have the highest case rates. And you can see how concentrated the cases are in the Proviso Township area, as well as in Cicero and Berwyn. The map on the right actually shows the percentage of the population that has at least one dose vaccination. And the darker the shaded areas, it means the higher level of vaccination. And you can see, unfortunately, that on the western suburbs of Cook County, you have areas that are largely shaded in lighter blue, as opposed to darker blue, which again means higher levels of vaccination. In this particular graph, just shows some comparisons across some of the communities in western suburban Cook County. So here, the graph represents the proportion of the population with at least one vaccine dose. And you can see here in that first bar, we are talking about suburban Cook County as a whole. And suburban Cook County as a whole has a vaccination of 45%. So 45% of the population has received at least one dose. And this is actually very similar to the city of Chicago. Now, Forest Park has a larger level of vaccination, which is great. But as you can see, most of the other communities, predominantly largely African-American communities and Latino communities such as Cicero and Berwyn, have lower vaccination rates, right? You can see that for Maywood and Bellwood are well below 45%. However, we do have Melrose Park, which is one of the bright spots here, who has a vaccination level of about 50%. So it is important to understand that we do have tools or layers of protection against the novel virus. There are things that we as individuals can be responsible for, such as wearing our masks, washing our hands, and avoiding crowds. And there are things that we share responsibility in as members of a community and society, such as getting tested and quarantining so not to expose others, and also getting vaccinated to stop the spread of the virus. Now, there are actually more than a few ways to get the vaccine, but this is the most straightforward. You can register online through the Cook County Department of Public Health, and they'll assign you to the spot in the nearest facility. Or you can choose to just walk up, and now they're accepting walk-ups at any of their major facilities. If you don't have email and you want to register, you can also just call them to make an appointment. If you need any further assistance, we're also here to help you. Please call us at the number on the slide or just visit our website. Now, without further ado, I'd like to invite Dr. Mora to start talking to us about women, children, and the vaccine. Dr. Mora, we can't hear you. I think you might be on mute.
Sorry, I've been talking for a long time. I'm so sorry.
It's okay.
Okay, I'll start all over again. Thank you, Dr. Silva. So let's rewind. Thank you. So yeah, I want to talk about the women and in the context of the pandemic, right? What are the challenges and losses that some of us have been following on us? And we know that COVID-19 pandemic has forced many young women to make a choice between doing what's best for them and their families and their careers. With online learning environments imposing unique caregiving responsibilities upon parents, mothers across the United States have left the workforce to be in care of the kids at home. There's a study from the Center for American Progress that estimated that COVID-19 closures are responsible for the permanent loss of over 4.5 million childcare slots nationwide. And therefore, everything from supervision and attention of lunches and activities that schools and childcare services once provided during the workday care are now the responsibility of working parents. And though both moms and dads have been left to fill these needs, mothers have been affected at a much higher rate professionally than parents. In that context, I want us to see that women have faced a burden, right? But there's also that we've seen a lot of misinformation that the vaccine may have been an effect on fertility for younger women. And that's mainly coming through regularly on social media. There's some guidance now and studies that are refuting a link between the vaccines and fertility. There is absolutely no evidence and no theoretical reason that any of the vaccines can affect fertility both for women and men. And in fact, people of reproductive age, young people, should get COVID-19 vaccine, including people who are trying to have a baby now or thinking about having a baby in the near future. This guidance is from the UK, and the United States endorses as well. Continuing with women vaccination, that we know there's extra concerns, and not just around fertility, it's around pregnancy, right, and the immunity transfer to the fetus and babies. So based on some reports from over 35,000 US women, some preliminary studies from the CDC, the results found that women who received the Pfizer or Moderna vaccine while pregnant had comparable rates of miscarriage, premature birth, and other complications compared to those observed before the pandemic. So there's no exacerbated risk in these women. In a separately study, the American Society for Reproductive Medicine, they have endorsed vaccination in pregnant women. This is based, and it has been evaluating for over a year now. Everyone, including pregnant women, and those seeking to become pregnant, should get a COVID-19 vaccine. The vaccines are safe and effective. That was a statement that the society did a week ago. Although pregnant women were excluded from many studies that led to the emergency authorization for the vaccine in the FDA, the evidence showed no harms in women who were unknowingly pregnant when they enrolled in the studies. But pregnant women who become infected with the coronavirus, we know they have faced elevated risk of complications, including intensive care unit, hospitalization, premature births, and death. Therefore, it's important that pregnant women get vaccinated. The risk that the risk of being pregnant and getting an infection outweighs the risk for getting the vaccine when you're pregnant. Also, there's data from a large cohort study of maternal antibody generation, meaning that when you receive the vaccine, how your immune system responds. And they compare these antibodies generated by the vaccine from the natural infection and how these antibodies are transferred to the new babies, the newborn, and when they're lactating or breastfeeding, and they actually confer a very robust maternal and neonatal immunity, meaning that the antibodies and the babies, newborns, are protected when they are in at least for a small period. So there's no risk for them and actually can benefit. Now let's move on a little bit about children and COVID-19. Where are we with the data with them? So now we know that children are making up the rising proportion of the new cases in the United States of COVID-19. It said that last week they reached about 21% of them, and this data is from the American Academy of Pediatrics. And you have some numbers there, and of those 3.6 million positive children tested since the start of the pandemic, they represent about 13.6% of all cases. And this trend will likely increase as vaccination is not still available for children under the age of 16, because there's going to create a shift in the risk of the landscape, right? Adults are not susceptible, therefore children, they can be more susceptible. And it's true that while most children do not get severely ill, more of them will require serious medical care in these days. The CDC and partners are investigating a rare but more serious medical condition associated with COVID-19 in children, which is called multisystemic inflammatory syndrome in children. We do not yet know what causes this syndrome and who is at increased risk for development. But we know it's a condition where different body parts can be inflamed, and among those, the heart, lungs, kidneys, and brain. We do not yet know what causes, again, but we know that many of these children had the virus, have been associated, infected with COVID-19, or have been around someone with COVID-19. And the truth is that many cases in children are asymptomatic, and they therefore can develop the syndrome. Next, please. So we know there's trials, and they're testing the Pfizer and vaccine and the Moderna. Most of them started in late March. And we have some promising results that we're going to talk about this. But before that, there's some questions that we have when we talk about children vaccination. And the first thing that we need to take into account is that children are not little adults, and they need a special approach. That's why we have special doctors, right, that are pediatricians. So some of the questions that concern us is, first and most, is do we even need to vaccinate children? We know that children rarely develop severe disease of COVID-19, and their deaths are not as many. There's an estimated one of them in around 1,000 cases can be very severe. However, we talk about this syndrome can be developed and has been associated, which actually is pretty serious. There's also evidence that is building the vaccines might block the transmission of the SARS-CoV-2 virus. So vaccinating children could have a beneficial knock-on effects on the wider community. So if we really want to get back to normalcy, we really need to achieve some immunity across all the groups in the population that will contribute to the transmission. So now the other question will be, how will the trials in kids work? So in some ways, vaccine trials in children under 12 years old is like the same as the trials from adults at the beginning. So the children will receive a range of doses and find which one triggers or which one develops a strong immune response without too many side effects. It's just find the exact recipe. Some of them are too much and some of them are too little, but that we have to get the dose identified. And this is done among 1,000 participants, and they would call it the randomized controlled trials or research studies. And they do it against some of them that do not receive the medication and see which ones are more effective, the same as with adults. Then they're gonna be followed for months, right? And then we're gonna get some results. Another question that we have is, will children and adults will respond differently to COVID-19 vaccine? To begin with, we know that children's immune system are brimming with cells that haven't been seen any pathogens at all. So they tend to produce a strong immune response to vaccines from the beginning. And it's not just specifically for this COVID-19 vaccine. It happens with all the vaccines. And in the beginning, the early trial results have shown that the 12 to 15 years old who received 2 doses of the Pfizer vaccine developed substantially higher levels of virus antibodies than the ones from the peers and 16 to 25-year-olds in early trials, which is good news. They will develop a complete immunity. So then, how will scientists will know if vaccines work in children? Again, those research studies or trials, they intend to look at blood markers, meaning for asymptomatic infection, meaning that they're actually going to take some blood samples and they're going to look for these parameters to see if they have the virus and if they actually develop some antibodies. And probably the most concerning of what we take us is if are they safe in young children. Safety is primary in children and in all of us, but again, children will be followed up with extra scrutiny and they will be taken care. Here are some experts that I pulled out from the news from this week. We have good development, and actually the children from 12 to 16 years old probably is going to be accepted or cleared from the FDA next week. And today actually was cleared to start vaccination in children in Canada. So that's our next step, and those are great news. They say they had 100% effectiveness for the Pfizer vaccine. Now there's also news that the new trials that I was telling you for the children from 5 to 11 years old, they're being successful so far, and they move into phase 3, and they expect by the end of summer for us to have results on those. And if everything goes well, they're expected for us to have a clearance from the FDA, and we can start vaccinating the kids at the beginning of the next school year. But we'll see, got to know. Next, please. And what I want to talk about a little bit more is other things that concern the children and the young. Can you advance the slide? Next slide, please. Thank you. So some of the things that we need to talk about children and the young people is how they've been affected, not just the vaccine, they have been out of school, right? They interrupted suddenly other social context and spend a lot of time with probably grown-ups and just with an environment. So we need to talk to them. Even if we're a year up on this, we need to remember that they react, right, both in what we say and how we say and how we're so far in this environment. So we need to learn how to talk to them about this COVID-19 vaccine. So we need to remain calm, right? We need to reassure them, tell them that they're safe. They need to feel safe no matter what the situation is. We're taking care of them. Let them know. We need to let them know if they're upset or afraid. That is normal, that we all feel like that. And we probably need to give them some tips on how to release the stress and coping. We need to make available ourselves to listen and talk. We're being so busy trying to keep our lives somehow above the level of the water, right? But we need to listen to them, right? We need also to avoid language that might blame others and lead to stigma. We have seen a lot in the news that it creates a stigma and perjury in some groups. We also, and very important, to pay attention what the children see or hear in conversations, in the television and media. They spend a lot of time online, and we sometimes are not on top of them, seeing what they're exposed to. We need to provide information that is truthful and appropriate. If we don't know something for truth, let's not make up information. Let's look at it together and try to have a conversation with them at the level of their understanding. And mostly they serve as us as role models. They teach children with everyday actions and how to spread and how to have all these all these measures that we're staying away 6 feet, washing our hands, how to put a face mask, and what best at doing ourselves. Remember that we're the role models. Let's also discuss if the school is open, what entails, what is going to be the behavior, what to expect. Remember that they have been at home and they probably are a little afraid of going back to socialize. Maybe they don't even know how to make a friend again. They might have been very anxious about that. Next, please. Some way to convey the information is during a simple picture. You can make it up, or there's so many resources. This is pulled out from the CDC. Put it in their context, how it looks even in the sidewalk, how it looks inside the school, what it's supposed to, how it looks 3 feet, how it looks 6 feet, how do I have to cover my nose and mouth, when do I have to take it off for lunch or not. If we explain all that simply and maybe with that little draw, they can understand that as little as they are, even from pre-K. Next one. And then I want to turn my attention to the young people, a little bit older kids and young people. They can be particularly overwhelmed by stress and related just to a traumatic event like the pandemic, which is for all has been something, but for young people especially, because they lost a lot of the social connections that they are so needed at that age. Some of them have fear, sadness, worry, and they actually can develop some other habits, right, and exhibit as unhealthy eating habits or sleeping habits, changing activity level. They can even start substance use or other risk behaviors, and they can actually have difficulty with attention or concentration. Let's have here's some prompts or to start a quick ideas of how to get a conversation with them. It doesn't have to be the same language, but the important part is to sit down or just start a conversation with the young people. They need some guidance. It doesn't have to be your child, it could be your neighbor, it could be somebody that needs some attention at some point. They are in need for talking with somebody. And next one, please. And with that, I want to open the floor for our conversation here. And thank you, everybody. Thank you for all the technical support. Yeah, Evelyn, Madeline, and Sergio. And I want to thank all your support. And let's get everybody from the panel and have some questions.
Okay, great. Thank you so much for that, Dr. Mora. And we'll welcome here Dr. Morales, Dr. Bertuman, and Ms. Gwen Smith. Okay, great. We have some questions already. So will the vaccines available right now be helpful to fight against the variant strains that appear to be more lethal and aggressive? So Dr. Bertuman, can you help us answer that question?
So yes, there actually is some data that's coming out that at least the Pfizer vaccine actually has protection against the variants, so specifically the B117 variant, which actually is the most common variant in the United States right now. Now, they haven't studied a whole lot about the other variants. I believe, I'm not sure which one it is, but there is one where there is some decreased protection against it, another variant, but they did specifically test against the B117 variant, and that has shown to be, the Pfizer vaccine has shown to have protection against that, as good a protection as the more common strain that's circulating in the United States.
Okay, great. Thank you so much. Next question. So someone's noting that they have concerns about the long-term side effects. Dr. Morales, do you want to speak to that concern?
Yes, I can speak to that. That's, we don't know of any long-term side effects. And that's always something that we should just be vigilant about. I wouldn't be too concerned or too anxious about that, because there is no evidence that there are long-term side effects. What we do know, and I want to emphasize, is that there are long-term side effects from getting the COVID infection. So that's something that you should have in the back of your mind when you're thinking about potential unknown long-term side effects of the vaccines.
Great, thank you. Did you want to add anything to that, Dr. Mora or Dr. Bertuman?
Just that, I mean, the technology of the mRNA vaccines has been around for a while, and so far they have not shown any kind of long-term side effects in other viruses. And I mean, just for reassurance, I mean, this vaccine, like all these vaccines, are constantly being monitored by the FDA and the CDC for any long-term side effects. So they are on top of it. And if there's any kind of side effect from the vaccine, it's released. So, I mean, they, like, for instance, with the Janssen vaccine, I mean, they were pretty fast about pausing the vaccine when they thought there was a problem with clots. And then they paused it, and then they studied it, found that risk was rare and the benefit outweighed the risk. And they were able to open it back up again to the public again.
That's right. And it's my understanding that part of the pause is also to make sure that people were vigilant about looking for potential side effects if they were in that age group, and to let providers know how to make sure they treat the patient. Am I correct? If they were to experience that side effect. So that other layer of safety, as you pointed out. Thank you for that. Next question. So I know some people that are not returning for their second shot. Will the one shot be enough to make them immune? Dr. Mora, what do you have to say?
Absolutely not. So to be specifically with the Moderna and Pfizer vaccines, which are, we know there are 2 doses, right? That's what the compliance should be. To be considered full vaccinated, you should have 2 doses. What happens with the first dose is just gonna generate, let's say, a short-term probably immunization, and in percent could be 50% effective, right? But it does not develop a cellular immunity, which is the long-term or the most long-term immunization. So yes, absolutely, you need both vaccines.
Okay, thank you. I was going to ask a question to Ms. Gwen. Ms. Gwen, hello. What have you been hearing in terms of some questions out in the community that folks might be concerned about? Oh, you're on mute.
There you go.
Sure.
I'm hearing questions about children. The main question is children returning to school in the fall. Will they need to be vaccinated in order to go back to, because we assume we'll be in school in the fall. So will they be allowed to attend school without being vaccinated?
That's a great question. Dr. Mora, do you want to
Yes,
try that?
I mean, it's going to take some time that IDPH and the state, right, get the regulation to get, I don't know, like everybody needs to, right, and enforce that, we'll say, but it will be recommended, I would say that, and it's for the good of the community. So the same as teachers right now, right? They're like encouraging that everybody gets vaccinated, and again, it's about not spreading more in transmission. Right.
So for right now, I guess
well, we don't even have the clearance yet. But, right. So it needs to be. It's a slow process, as we know that the state and the health departments move.
How soon do you think that they'll have the vaccine available for 16 and under?
Well, probably next week we have the good news that we got the FDA clearance for the 12 to 16 years old, 12 to 15, because 16 already are in. Yeah, in Canada was actually today was cleared, and that was great news. Canada, they're starting vaccinating their kids tomorrow from 12 years on over. So we're expecting that to roll out Monday, probably next week. I don't know when.
That is exciting. I registered my kids on the County Department of Public Health website, so I'm ready to make that appointment. Thank you.
I have a question. I've gotten this question in the community regarding testing of children 10 and younger. How is that going? Do they have to go to their pediatrician? You know, is special care taken with them? But right now, I think the regulation, well, everyone's just about following at the test centers, is 10 and over. What do we do with the kids 10 and under for testing?
Dr. Bertuman, I'll give that one to you.
Actually, I might defer to somebody else because I am a adult medicine doctor. So, so I'm actually not sure that answer to that question.
I have some insight, but I'll give it to Dr. Mora. Do you have insight on that? On the testing?
I have an insight, it's not for sure, but I do know that in my community they're testing it and that's from my child's school, right? If they have a positive case, they send them to the local area to test them. So I know they're testing kids, like, and he's 6 years old, so they actually test him younger. Yeah. And it's the Nasopharyngeal test, not the saliva.
So, but they typically
Yeah,
refer
then
you
they
to
don't
your
have-
pediatrician. So
Yeah.
they refer you to your pediatrician, correct? Dr. Mora?
No, it's a community test, just like the CERCL community test. It's in an
really?
area, it's in the Park District, so it's not the
wow.
pediatrician.
So
I
this
know
is awesome.
pediatricians, they do take it, but they're also like that. I'm not sure. I
Mhm.
haven't been there, so I cannot speak for that.
All right. I know CERCL is looking into possibly being able
Yeah.
to test those younger than the age of 10 because as the schools have opened up, right, and kids are participating in sports,
But-
it seems like, right, there's
They
a
needed more,
need.
yeah. And they're going to camp this summer too.
Right.
Yeah,
So they
but-
need it for that.
But technically speaking, right, it's not a different procedure. It's just the anatomy is the same. It's just, you just have to have careful to swab in the, not towards the eye or towards the brain. Just gotta get in the floor of the nose and get to the nasopharynx. It's just like any procedures.
Yep.
For the, I train I'm an ENT, so I'm speaking a lot. So.
Okay. So could an unvaccinated child infect a vaccinated or unvaccinated adult in the home? Dr. Bertuman, I'll give you that question.
So yes, absolutely. I have seen patients in my practice that have been infected by their children, actually. So definitely an unvaccinated child can infect an unvaccinated adult, for sure. I mean, part of the issue with children is that they don't appear. I mean, thankfully, they don't. As was mentioned in the presentation, they don't have a lot of severe infection, but they can have asymptomatic infection, and that almost makes it a problem because they could seem well but pass it on to their parents if they're unvaccinated. And of course, with vaccinated adults in the house, I mean it's basically like the percentages that you see with the vaccine. It's like 95% chance that you won't be infected with with COVID if they're vaccinated, and like a 99% chance that if you are infected, you won't have any severe infection or hospitalization.
Right. If you're vaccinated. That's
Yes.
great. Thank you. Thank you for that. Another question. Should I delay getting pregnant if I got the COVID-19 vaccine? Dr. Mora, I'll give you that question.
No. You can go ahead and get pregnant. No, I mean, if you're vaccinated, you're good. You're good to go.
Okay,
And
good.
if you're pregnant, you can get vaccinated as well. Just
right.
try to avoid the first trimester. There's no studies about that, but it's like any medicine, we want to avoid the first trimester, which is the first 3 months.
All right. So good luck. All right. So which vaccine is better for pregnant and postpartum women? Dr. Morales?
Well, I again, I'm not a OB-GYN, but I'm an adult medicine doctor as well. But I looked up the guidance from the experts, the OB-GYN experts, and when the Johnson & Johnson vaccine was paused, they encouraged the Pfizer and the Moderna vaccine. But they took a look at the evidence, and no pregnant woman or postpartum woman who received the Johnson & Johnson vaccine was affected, was not part of the 6 people that developed the blood clots. So as of right now, there is no official recommendation. There's no product preference. However, pregnant, lactating, and postpartum people aged less than 50 years of age should be aware of the risks of clotting after receiving the Johnson & Johnson vaccine. So I think, in my opinion, I would say, because of this risk, there is no science saying there's one better than the other or safer than the other, but because of this potential risk that we all know about, in my opinion, in an abundance of caution, if for your own, peace of mind, you can take the Pfizer and the Moderna vaccine, but there is no official recommendation or preference.
Okay, thank you. Does anybody else want to add to that, Dr. Mora, Dr. Bertuman?
No.
I think I would agree with that, just because, I mean, pregnancy in and of itself has increased risk for clotting. So, I mean, just kind of combining those two risks may be an issue. But I agree with what Dr. Morales was saying in terms of there's not one specific one, but for peace of mind, you're more than welcome to go for the Pfizer or the Moderna vaccine.
That sounds great. Thank you. And it seems like there's plenty to go around in the community as of right now, so that's exciting.
Mm-hmm.
Okay, should I stop using my birth control if I get the Johnson & Johnson vaccine? Dr. Mora?
Again, I guess we go back to the same concept that we know the birth control pills, right, increase the likelihood of clothing. So, and therefore females, and we know these participants or these patients that receive the Johnson & Johnson were young female or less than 50 years old reproductive age. And now we have vaccines available, like many options. Just stay away from Johnson & Johnson.
Okay, great. If you've
keep your birth control pill.
Okay, great. Thank you. If my baby has had some of her vaccines, is she protected from COVID-19? We are anxious for her to meet family members. Let me see, Dr. Morales.
Yeah, so as of right now, we're not providing vaccinations for infants. However, if you
COVID vaccine, I think you mean.
Yeah, COVID vaccine, sorry. Yeah. If you had all the other vaccines, they protect you against other infectious diseases, but not specifically against the COVID-19 disease. So if the baby had a mother who was pregnant and received the vaccine, or received the vaccine postpartum and is breastfeeding, then the baby would likely acquire the immunity via breastfeeding. And another interesting news is that there are women who are selling, women who were pregnant or postpartum who received the vaccine, they're selling their breast milk. So, that's out in the market, and that's also, available to those who are interested in providing passive immunity to their babies.
Okay, great. Dr. Bertuman, are there other things too? Thank you for that. Are there other things that for example, this family can do to help protect her family and her baby from COVID?
Sure. What I would also add to that is that, the current guideline is that people that are like vaccinated, fully vaccinated, can be in the same household, like no social distancing, like without masking. And same goes for vaccinated people and unvaccinated people that are at low risk. So it would be good if family members could be also vaccinated as well, because that would provide protection for their baby and anyone who's unvaccinated in the house too.
Okay, great. Yes, I think that my sister had a baby and I hadn't been vaccinated and I wanted to kiss the baby, I would definitely get vaccinated. So
Right.
that's an incentive too, right? To
Yeah.
keep her safe. It's more fun to be able to kiss the baby without the mask on. Okay, thank you for that. So we don't talk about herd immunity for protection against influenza or other common viral infections. So why is it discussed so much with COVID? That's a great question. I'm gonna give it to Dr. Bertuman.
So the reason for that is because influenza and like herd immunity with influenza and other common viral infections is very, very difficult, if not impossible, because well, for one, in terms of influenza, the reason why a vaccine is given every year and not like one vaccine like for a lifetime, like measles, is because it changes every year. So like there's always some kind of rearranging of their genes that makes it susceptible to human beings. So that's why they have to give a different vaccine every year. So that's why they don't talk about herd immunity with influenza, because it's very, very difficult. I mean, they obviously recommend getting the vaccine every year because that will decrease the transmission, but it's very, very difficult. Same goes with other common colds, because it's just very difficult to pinpoint one virus and like give a vaccine for it. Now with COVID, I mean, we're still learning about it, but so far we have a vaccine that can protect against the most common COVID strain that's circulating throughout the United States. And we're finding evidence that it can actually be protective against the variants too. So the discussion about herd immunity is actually more relevant for COVID than it is for other viral infections. Now, that being said, I mean, I was just recently reading articles that it might be very difficult to achieve herd immunity with COVID as well because of vaccine hesitancy, and also because, I mean, we're still learning about the variants that are circulating. Like there might be a possibility that it could become something like the like influenza. But as of right now, our evidence suggests that the vaccine can be protective against not just the circulating strain, but other variants as well. So that's why we're still talking about herd immunity with COVID.
Okay, thank you for that. And this is also why we're having some of these conversations, right? So people could ask their questions and voice their concerns, and hopefully we could allay some of those fears. What are some of the other fears that you've been hearing out there, Ms. Gwen, in the community about why people may or may not be doing the vaccinations? Oh, you're on mute.
I was just talking to my play brother just this afternoon, and he was saying, now his mom, he stays with his mom and dad. They both had COVID. They had it, he told me, you know, a pretty bad case of it. They're okay. I said, but he said, I don't know, sis, about getting the vaccine. I said, but look at this. If you don't get it, then you have the possibility of getting COVID. Now, which is worse? If you get COVID, you can get a bad case of it. And, you know, you can really be sick, hospitalized, and you know what the other thing is. Or you can, and also you still need to protect your parents that you're staying there in the house with. So am I telling them the right thing, doctors?
You are. Yeah, let me speak very quick, and then I think JB could be more suitable for. Even if someone had COVID, that doesn't mean that it's not can get reinfected, right?
Yeah.
And especially if your body went through a bad case and it probably has some consequences that is weakened. So you want to take care of these people as well, and they have to get vaccinated as well. Oh, there you go.
Yeah, that's one of the questions we had actually. If I already had COVID, do I still need the vaccine? Go ahead, Dr. Bertuman, you can take that.
Yes. So yes, because, well, number one, because you know, as Dr. Mora was saying, reinfection is possible. So, I mean, we know that you have pretty decent protection regardless of the type of infection that you have, whether it was mild or severe, like in the first 3 months. But then reinfection after that time is certainly possible. And now some people will mount a pretty decent response to their infection and have longer protection than that, but people that have more milder infections may not, and then reinfection is possible. So absolutely, people who have had COVID in the past should get vaccinated. And also, another thing to mention too is that we even recommend people that or have been recently infected go ahead and get the vaccine as well. Like when they're, we initially had been saying wait 3 months after your infection to get the vaccine because it was in short supply, but it's actually the rollout has been pretty good, and it's more available now. So we say well, get over, you can get over your infection, and then after that you can get the vaccine. Okay. Now, also, what I was also reading before, it was actually from Dr. Fauci, was that people that have actually had COVID in the past can actually mount a better response as well to the vaccine. So, so that actually is pretty helpful because that can provide like longer immunity than natural infection alone.
Oh, that's great. Good to know.
Great to know that.
Mm-hmm. Yep. Let me see. Are there any other questions? Can I get the COVID-19 vaccine during my menstrual cycle? So is there a reason to prevent it or avoid that? Nope, there's no reason that we're aware of. Nope.
No.
Feel free, get it as soon as you can. So why was I told to wait a month after getting the COVID-19 vaccine before getting a mammogram?
Yes, because when you develop an immune response, right, all your lymph nodes, right, the axillary region can get enlarged, right? Yeah. And it said that it lasts for weeks. So you don't want to have a mammogram and get mistaken that you have a mass there.
Yeah.
And even the tissues in the glands, right, themselves can have some lymph nodes and lymphatic tissues. You don't want to get enlarged and get mistaken by something different. So it's a month at least.
Oh, that's good to know.
Understandable.
Okay, that makes sense. Thank you. I hadn't heard of that, so that's good to know. I'll pass that along. Should I take any specific measures if I had the Johnson & Johnson vaccine? I guess that person's still kind of worried. Dr. Morales, do you want to take that one?
No specific measures, just be vigilant and be self-aware of the symptoms. If you have headaches, if you have, neurological symptoms, anything out of the ordinary, go ahead and talk to your physician and let them know that you got the Johnson & Johnson vaccine, and they'll provide you with a proper treatment if it's adequate. But no other specific measures are needed.
Is this, am I vigilant until, for how long should I be vigilant about these potential issues? For a week or two?
I mean, I don't know of anything, but I would assume at least within the first 28 days. But I don't know if anybody has read anything else.
Well, we know the cases they were saying between 7 and 2 weeks, I think. So 7 days and 2 weeks. So those are the cases that we know about. So I don't know.
So shorter term than it is longer term.
Yeah, not long term. It's supposed to be.
Oh, okay.
Okay, great. Thank you. Let's see. We might not have any more questions, I think.
Okay.
So that's good. Is there anybody else want to add anything else in terms of women, children, the vaccine? Anything else out there?
No, just like we might have to update this soon, right? It's there's still developments. We are excited that they're doing these trials. Hopefully everything goes well and we can vaccinate our kids, right?
Yep, and reach that herd immunity.
Just trust the information comes from the right sources. Not everything that is out there is true. You just gotta be aware where you get your information from.
I heard something today. Get vaccinated and live. Get COVID and die.
That's right. Right. That's right. Thank you so much for that. All right, and on that note, have a great night. Thank you for joining us. We'll be here next Thursday. We'll have a Spanish version of this. Okay. Have a good night.
Good night.
Bye.
Bye.
Good night. Thank you.
Bye.
Well, I'm 61 years old. I lived in Maywood for 59 years.
I did my high school years here. I met my high school sweetheart. We got married here.
This is my home.
The village of Maywood was going back and forth in the beginning of the pandemic of being the #1 community as being widespread.
Us in public health knew that this pandemic, like any disaster, always disproportionately impacts the most vulnerable.
So it became clear very early on that Black and brown communities were being particularly hard hit.
People of color that's in these neighborhoods, they cannot get the resources that they need.
COVID is real here. I've been to a lot of walk-through funerals.
Information just didn't get to us, as quickly as it should have.
It was frustrating for me from a trustee standpoint that the residents were calling saying, why doesn't Maywood have a place we can get testing? Why doesn't Maywood have a place we can get testing?
Really immediately, the feeling of the importance of outreach, of understanding the people that were going to be our patients in their context, in the community context, is really important.
CERCL is trying to be there for those that doesn't have access to food, to testing, or to education.
The acronym stands for COVID Equity Response Collaborative Loyola. It's a collaborative, an interprofessional collaborative of nursing, faculty, students, and staff, medicine, law, public health, healthcare administration.
We need to be good citizens in the communities in which we serve and really come together and work together to find solutions that address these problems of inequity and can be sustained and improve health for the long term.
We're not telling them what they need, right? We're hearing what they need, right? And we're sort of responding.
Reaching out into getting testing into those communities, going to where they are so they don't have to travel out of their communities to get this testing. As a future physician, meeting those individual people, helping them is why I want to do this, really build that community relationship.
Loyola brings credibility. People believe in Loyola around here. For them to reach out and be actually here at 9th and Madison, means a lot.
The mission of CERCL is to address the health inequities that our communities of color are facing on a daily basis.